Yes, Terence. Yeah, last time we were here, we were discussing about some development in Lecudo, what your leadership wants to do. You are the head of the leadership. One of the crisis or one of the issues now in the air is the COVID-19 and the vaccine. And what has been your take in educating the community, especially the Bank people and the Lecudo people in the USA?
Yes, and again, thank you for having us. And we also want to thank you for the job that you are doing. Because you're really part of that team that is really trying to educate our community, GASA Media. And again, as we talk about my general assessment for the situation with COVID and the response by our community, I think so far we make a lot of progress. With all the town halls that we've had, with all the online presence that we've had, our experts being on WhatsApp, where we forward deployed each time that you have some controversy coming on through our platforms. We have our experts, Dr. Lemja and the rest, Dr. Edmond, Dr. Arako, really attack that head on to provide clarity and be consistent about what the health experts are saying.
Yes, Terence, if I may ask you again, do you think this information is actually enough? Because sometimes it seems that people, because once you have one controversial issue that, oh, somebody have an allergic reaction after taking the vaccine, you see the news will go so wide that, oh, do not take the vaccine, the mRNA vaccine, they are not the regular kind of vaccine. So with all these changes in information, you as the head, because almost every responsibility seems to fall on you. What is the leadership going to educate the community? To me, I think it's part of the responsibility.
Yes, I agree with you, Mr. Kubra. And that's why education has to be ongoing, because you would have very negative information that it's arising, but secondly, you have a lot of activity going on just within the medical community when it comes to the vaccines. You have the new vaccines being approved. You have studies, we just have to acknowledge that COVID research on vaccines, it's just like every other science. They begin and then they improve. So things come up, people report side effects, just like all our quinones, chloroquine, nevaquine that we used to take for malaria. It's been updated, and that's why at one point they say hydrochloroquine, we don't no longer take nevaquine, and they say, oh, because there's an active, there are some side effects, and then they improve on it. So the whole idea of people saying that there are side effects, that is a given, right? It's a good thing that when new products are brought to the market, there's continuous studies carried on those products, right? People take it, the scientific community, the research community finds out that there are some new side effects. They figure out how to improve, how to mitigate those side effects, and then collect that data, right, and see where they can improve, and also maybe help them now identify additional data sets, individuals that they can add to their sample size for studies, right? So it's a good thing, but just to address your question, education, awareness creation, sensitization is an ongoing process. So far as the COVID is here, that process to us as the Lecudo USA, we have resolved that it has to be ongoing. We need to continue, our experts need to continue to avail themselves and assist us in educating our people, because not everybody, even when we go to class, we're in class, not everybody understands, teaching, gets information at the same level,
yeah,
right? Some people you have to teach them 2-3 days more, but somebody will just look at it and understand. So it's
okay, yeah, that brings me to my next question, because the convention is soon coming on. We're talking about probably July or June, which is maybe literally 2.5 months from now.
Right.
So how do you think the convention this year is going to look like?
That's a good question. Nothing is normal. When it comes to COVID-19, we need to just agree that it cannot be normal. It cannot be business as usual, right? But we also need to agree and affirm that the science is going to dictate based on science. But the third thing is we are responsible as an organization for the protection and the safety of our people. So whatever decision the organizing committee is going to make is going to take into consideration those three items, right? That is key. So we're leaving our options open. We are allowing science to dictate what direction, what conclusion we conclude. But we're also making sure that we prepare so that if we have to do an in-person convention, there has been planning for. Those options we are planning, having contingency planning for all those three options, right? Whether it's an in-person convention, whether it's just a virtual convention through Zoom, or it's a hybrid where there's a combination of the in-person convention and the virtual for those who don't want to come in person. So we're planning for those three contingencies.
Yes, sometimes too, I believe the kid may also have an important role. Sometimes when we talk about transmission of information, the way the USA sit on the dining table, when you are discussing things, back in those days where we used to sit around the fireside telling story, that's where sometimes information is conveyed, not like in the very formal kind of setting. There's a need for them to take the vaccine. What would be your take in that direction? Or do you think some kids may have the role to play?
Yes, and that's also something we're looking into. Also making sure that it's also going to help also check that box where we're trying to integrate, bring all facets of our community involved in the Lecudo activities. So we talk about COVID. What we're also thinking is just bring some real persons, right? Bring the kids to come and talk about how COVID is affecting them, and what also their parents and adults need to do to help them. For example, Precious, my daughter, believes that they would like to go in person, to study in person. But for that to happen, what they are requesting from the parents is to take the vaccine.
Will you also like to go back to school as well?
Yes, I would.
Okay. Let me ask you, what do you think it would take for you and parents to prepare you to going back to school moving forward?
Well, I've heard about many adults who don't really look forward to or don't really want to take the vaccine because they have doubts about it. But I would suggest for them to take it because many schools, they only open depending on the amount of people who die or are sick from the COVID virus. And when they take the vaccine, it reduces the number that happens per week or per day, which means that we could probably go back to school sooner.
Okay, Precious, it was a pleasure having you here at GASA Media.
Bye.
Okay.
Because sometimes, parents listen more to their kids. What we're also planning looking forward is to bring forth real testimonies. Elders who have taken the vaccine. So we just come and talk to other elders. Most often people listen to people look at them and they feel more comfortable.
Yeah, that's true.
Right.
Terence, thank you so much for taking this time to be with me and to give all this update to Lecudo and the community and the BLM at large with this wonderful kind of information. We cannot thank you enough for your humanitarian service and for your...
Thank you, Mr. Ernest, and thank you, GASA Media. But also, we just want to thank all our stakeholders because everyone is doing a little bit to contribute to this, right, to the education. Even those who are skeptical, right, we just want people, if you are skeptical, please bring your skepticism to the public forum, but also be constructive, also be open-minded, be willing to listen. Don't just come and say, oh, you won't do this, that when you are not a scientist. Pose your questions, but also allow the answers to inform your decision. So thank you again once more.